This is a demonstration on the application of silver diamine fluoride. So start with the lap-to-lap exam positioning and make sure that the parent is holding the child's hands down and feet to make sure that they do not reach up. And we want to try and avoid any unnecessary staining, so it's good to start with some Vaseline on their face and lips. And with the applicator brush in hand, you're going to dry the areas that you're going to apply the silver diamine fluoride and try and keep them isolated. And then you can dip the applicator brush into the silver diamine fluoride and just try and paint only the carious lesions that you are focused on arresting the caries, utilizing the applicator brush. And then attempt to keep it isolated for as long as you can. 10 seconds would be great, depending on the behavior of your child. And then go ahead and wipe off any excess with the 2x2. And you want to make sure that your assistant disposes of anything that has touched the silver diamine fluoride properly. Now, if you're doing an interproximal lesion, you can use some super floss. And again, you're going to want to isolate the area well with some 2x2 gauze. And dip the super floss into the silver diamine fluoride. And this is the tricky part because you have to figure out how to isolate and try to avoid the silver diamine fluoride touching any additional areas of the child or their skin or any other unwanted areas. So isolate and then slip the super floss into between the teeth. I do try and warn the parents that we may still see a little bit of staining on their face, but it will resolve within 3 to 7 days. And you can immediately start wiping their little face with hydrogen peroxide if you are concerned you got some on that area. You just slip the super floss in there, attempt to keep it isolated for a good 10 seconds or so, and then wipe off the excess with the gauze. And then again, you want to dispose of everything properly. So I have asked my assistants to make sure that as soon as we're finished, she's going to take some gauze, wipe out any excess silver diamine fluoride out of that dampen dish, and then she'll wrap it inside her gloves and immediately dispose of it into the trash.